Many adults over 60 know this feeling all too well. You stand up from a chair, and for a moment, the room feels like it shifts. You take a step, and your body doesn't feel as steady as it used to. Maybe you pause, grab the table, or wait a second before moving again. It can be scary. And if this has happened to you, you're not alone. A lot of people worry that this means their legs are getting weak, but in many cases, the real issue doesn't start in the legs at all. It starts much higher up, deep inside the ears. Most of us never think about balance until something feels wrong. We often assume balance comes from strong legs, but balance is really a team effort inside the body. 3 systems work together to keep us upright. Our eyes help us see where we are. Our muscles and joints help us feel movement. But the inner ear is the boss of the operation. Inside each ear is a tiny balance center. You don't need to remember any medical names to understand it. Just imagine a small level tool, like the kind builders use to see if a shelf is straight. Inside the ear are tiny tubes filled with fluid and very small, hair-like sensors. When you move your head, the fluid moves. The tiny hairs feel that movement and send messages to the brain, and those messages tell the brain if you're standing, walking, turning, or, starting to lose balance. The brain then sends instructions down to your legs and muscles, telling them what to do. When everything works smoothly, you move without thinking. When it doesn't, your body can feel slow, unsure, or off balance. This is where balance and leg strength connect. Even strong legs need clear instructions. If the inner ear sends weak or mixed signals, the brain hesitates. The legs may react late. Steps may get shorter. Muscles may tighten. Over time, the legs can feel weak, even if the muscles are still there. As we age, changes in the inner ear are very common. Some of the tiny balance hairs may fade. The fluid may not move as easily. Nerves may send slower signals. The brain may take longer to respond. These changes happen little by little, which is why balance problems often sneak up over time. Other things can make balance worse. Not drinking enough water can affect the fluid the ear needs. Some medications cause dizziness or lightheadedness. Vision changes can confuse the brain. When these issues pile up, balance can feel unreliable. This is why falls are so common and why they're not your fault. Most falls don't happen because someone is careless. They happen because the body's balance messages are delayed or confused. Standing up too fast, turning quickly, walking on uneven floors, or moving in dim light can all trigger a fall. The good news? Balance can be supported at any age. Small, safe daily habits can help the ears, brain, and legs work better together. One simple habit is gentle head movement. The balance system gets better with use. Slowly turning your head side to side, looking up and down, or moving your eyes while keeping your head still can help retrain balance. Do this while sitting or holding onto something solid. Slow and steady is best. Drinking enough water is also very important. The inner ear depends on fluid to send clear signals. Even mild dehydration can make dizziness worse. Sipping water throughout the day can make a real difference, unless your doctor says otherwise. Daily walking is another powerful tool. Walking tells the brain we're moving safely. It strengthens the connection between the ears and the legs. The walk doesn't need to be long. Around the house, down the driveway, or with support is enough. What matters most is doing it often. Practicing standing balance can help too, as long as safety comes first. Hold onto a counter or chair. Try standing with your feet together, shifting your weight side to side, or lifting one foot for a few seconds. These exercises should feel challenging but calm. If you feel unsafe, stop. Good lighting at home is an easy win. The eyes help the brain stay balanced. Poor lighting makes the inner ear work harder. Night lights, bright hallways, and lamps near beds and chairs can lower fall risk right away. Medications also matter. Some drugs can cause dizziness or weakness. If balance problems show up, talk to a doctor or pharmacist. Never stop medication on your own, but always ask questions. Confidence plays a bigger role than most people realize. Fear of falling can actually make balance worse. When we're afraid, muscles tighten and movement becomes stiff. Moving calmly, using support, and noticing small improvements helps the brain trust the body again. There are times when medical care is important. Sudden dizziness, frequent falls, ringing in the ears, or hearing changes should always be checked by a healthcare provider. Early care can prevent injury and lead to better treatment. Balance starts in the inner ear. Aging can weaken balance signals, making the legs feel unsteady. This is common and not a failure. With gentle movement, good hydration, proper lighting, and patience, balance can improve. Always put safety first. Hold on to something sturdy. Stop if you feel dizzy. Wear supportive shoes and keep walkways clear. Your body is still capable. With understanding and care, balance can grow stronger, and confidence can return.